Good afternoon, I'm Sean Yao, and this is One News Now. The Metro Manila Council is asking the government to temporarily forgo buses and jeepneys once the region shifts to a general community quarantine. The pitch comes as all Metro Manila mayors voted in favor of the shift to GCQ come June 1. Lynn Olivario with the rest of the story.
All 17 NCR mayors from Metro Manila voted to place the region under the General Community Quarantine, GCQ, once the modified Enhanced Community Quarantine status is lifted on June 1st. But one of their worries is still the resumption of public transportation operations. In an interview with One News, the Chiefs MMDA General Manager Jojo Garcia said the MMC also asked the government to forgo buses and jeepneys for at least 2 weeks under the GCQ due to social distancing concerns. The Metro Manila Council suggests to only allow certain PUVs such as shuttle buses, TNVS units, taxis, point-to-point buses, tricycles, and pedicabs.
When it comes to PUVs, ang na-request namin, wala mo ng bus and jeepneys, ano? Actually, alam ko, magpe-present ang DOTR din, I don't want to preempt them. Pero yung mga shuttle, papayagan natin yan, tricycle, pwede yan. TNVS, taxi, papayagan yan. Kasi nga, mas madaling i-monitor yung laman.
Should the IATF heed to the suggested shift to GCQ, Garcia says they are anticipating an additional 30 to 40% vehicles on the roads. This calls for the need to bring back the coding scheme, but modified. Garcia says the MMDA is already working on a resolution for the modified coding scheme. As for the recommendation to downgrade NCR from modified ECQ to GCQ, Garcia says the primary factors are the pressing need to balance health and economy.
Oh, that's the wisdom of the ITF. Kasi pagdating sa kanila, may health issues, may economic issues, may enforcement issues, di ba? Yung sa amin, based lang sa nakikita ng mga mayors natin na kailangan tumakbo na yung ekonomiya natin.
For News 5, Lynn Olivario, we are One News.
The Department of Social Welfare and Development, or DSWD, asks LGUs, or local government units, to transmit their liquidation reports on the first tranche of the Social Amelioration Program. This is for the immediate release of aid of the SAP's second tranche. The department says the reports will still undergo validation and vetting that will take around 15 days. The DSWD adds it is exhausting all means to shorten the vetting and validation process, and hence it is appealing for the full cooperation of LGUs to expedite the process. And a lawmaker is urging government to provide subsidy and loan programs for teachers as the resumption of classes remains uncertain. Pampanga's 3rd District Representative Aurelio Gonzalez Jr. warns that the delay in the reopening of classes could seriously affect the employment of teachers and other school personnel in both the public and private sector or institutions. And this comes as President Duterte opposed the return of face-to-face classes until a COVID-19 vaccine becomes available. Gonzalez says it will be up to the concerned agencies to determine the amount of aid that will be given to the teachers. We're going to pause for a quick break, but we will be back with more stories after that. Stay with us here on One News. Afternoon, this is One News Now. 11 students from Cebu who availed of the government's Balik Probinsya program tested positive for COVID-19. According to the Ministry of Health of the Bangsamoro Autonomous Region in Muslim Mindanao, all of the students are now quarantined at the Maguindanao Provincial Hospital after arriving at the province on May 15th. Minister Dr. Safrula Dipatuan says they were supposed to go to the towns of Sultan Kudarat, Sharif Aguak, Datu Piang, Buluan, South Upi, Datu Odinsinsuat, and Datu Paglas. Last week, a 22-year-old male student from the same group turned out positive for the SARS-like disease. And under the guidelines of the Balik Probinsya program, the local government where locally stranded individuals or LSIs have been residing must ensure that they have gone through 14 days of quarantine. It is up to the receiving LGU whether or not to place the LSI under another 2 weeks of isolation. With the new confirmed cases, BARMM's total infections now stands at 23. Health Undersecretary Maria Rosario Vergeire announces that it has now 44 accredited laboratories for COVID-19. Actual tests conducted daily now stands at around 8,500 to 9,500. Vergeire says the health department saw a downward trend on the number of conducted tests due to the shortage of supplies in some labs. However, she assures that they have already taken steps to source these materials. On Wednesday, the country recorded 350 new cases, bringing the national total to 14,669. This is the highest recorded COVID-19 cases since May 8th. Vergeire explained that the rise is due to the inclusion of tests done to returning overseas Filipino workers. We'll have more stories after a quick break. We'll be right back here on One News. You're still with us here on One News Now. With the long lines going into pharmacies amid the pandemic, the city government of Antipolo came up with a way for people not to have to leave their homes in order to purchase medicine. For the details, JC Cosico is joining us live from Antipolo. JC, exactly how is the local government doing this?
Yes, in the bid to lessen the residents' need to go to these establishments while under GCQ, the city government of Antipolo has launched their online botika or e-botika program where residents can avail their medicines. To place an order, the customer has to visit the Facebook page of Antipolo e-botika. A chat support group will get the customer's contact details, order, and drug prescription. They will also ask a copy of their valid ID and a selfie for confirmation. Senior citizens and PWDs may avail discounts. Once an order is placed, it will be sent to their partner drug store for a price quotation that will be reviewed and approved by the customer. There is no minimum or maximum amount for the order. A person from the LGU is tasked to avail the medicines that will be delivered straight to the customer's residence the next day. Payment is made through cash on delivery or via online payment such as PayMaya with no service fee. Sean, Antipolo's e-palengke e-botika accepts orders from 9 a.m. to 12 noon daily. And last month, they also launched their e-palengke program, which aims to lessen the residents' need to go to the market. As of yesterday, the city has a total of 153 COVID-19 cases with 61 recoveries and 26 deaths. Sean?
All right, with regard to prices and price differentials, JC, how cheap or expensive, or is it average price, the prices of the medicines from the e-botika program? Or would residents have a choice of which drugstore the local government can avail or purchase their medicine?
Sean, the LGU has partnered with a specific branch of a drugstore here in the city where they will get directly the medicines that will be availed by the customers. Sean?
All right, with regard to the e-palengke, how does that happen? What's the details on that? And when is Antipolo City to roll that program out?
Yeah, Sean, the e-palengke was actually launched last month. It's the same thing like this e-botika, where it's also aimed to lessen the residents' need to go out and go to the market, where they just can visit the Facebook page of this e-palengke where they can place their orders. Sean.
All right, I can't help but notice behind you, JC, there's quite a lot of people on your left-hand side, right behind you. What's going on over there?
Okay, so since Rizal is placed under GCQ, we are actually seeing some residents here going in the market. So meron namang mga tao dito from the LGU who's reminding them of physical distancing. Sean.
All right, thank you very much for that update from Antipolo. JC Cosico of News 5. Thank you. For more updates, follow News 5, The Philippine Star, and Business World online. I'm Sean Yao, and we are One News.